time for everyone. So I truly appreciate it. So my talk today is specifically about foot and ankle surgical residency, which is what program I'm in, and also the field of podiatric medicine, kind of talking about the application, the school, how you get to where I am, and just the logistics behind all of that. So kind of an overview of our discussion, I'm going to kind of talk about my journey and how I kind of found the field of podiatry and what podiatry is and what podiatrists do. And then I'll kind of go into how you can get into those requirements for getting into podiatric medical school, what our day-to-day curriculum is, how we apply for residency. I'll kind of touch base on also the difference between MD, DO, podiatry, just so for people who aren't aware, you guys kind of get familiarity of the application process, what to expect, and kind of going from there. And then residency, I'll talk to you about my day-to-day. I am a first-year surgical podiatric resident, so I'll kind of discuss what I see on a day-to-day and what you can kind of expect in regards to residency. And then finally, I am going to leave time for any questions or answers. So if you guys want to put any questions in the question mark or chat feature box, I will kind of address it at the end. So that way we can leave room for questions. If multiple people have the same ones, we'll see it at the end. So kind of my story, I initially began my journey. I was born in India, and I moved to Pittsburgh, Pennsylvania when I was 5 years old. And the reason I kind of got into the field where I am is in Pittsburgh, there's a huge, like, it's a sports city, and I loved like sports specifically. Like growing up, I played tennis, and I'm also like a huge football fan and a hockey fan. So I always like loved sports, and kind of leading into how I got into podiatry is sports medicine. So I'll discuss that a little bit later on. I went to the undergraduate at the University of Pittsburgh, and I majored in biological science, and I minored in chemistry and religious studies. So a lot of questions I get from pre-meds that I interact with is they ask me, what if I am a sophomore and I am a communications major or I'm a business major? And my personal opinion is that you don't have to be a bio major or a chemistry major. As long as you finish your pre-med requisites to get into medical school or podiatric medical school, you should be fine. And I'll kind of discuss what the requirements are on a little bit later on. So it is okay if you're a different major. It's not going to hinder your success, but you are required to do certain classes to get into podiatric medical school. I subsequently always knew I wanted to be in medicine, and I think that because of my personal circumstances at that time, I ended up taking my MCAT and decided to go to grad school at Georgetown, and I ended up getting a master's in physiology and biophysics. My curriculum in grad school is very strenuous, and it was kind of like a grueling process for me. And I did do really well, but I kind of learned how to study that was effective for me. And things I did in undergrad wasn't essentially the same in grad school. So I think that it kind of made me a stronger candidate when I ended up applying for medical school. So I think that I really want to focus my talk actually being on a non-traditional. I think that there's multiple ways to get where you want to go, and some people are very good at just going straight from undergrad to going to medical school, and that works for them, and that's fantastic. For me personally, I think being a non-traditional kind of strengthened me. I learned what study methods were effective for me. I learned that I'm a visual learner. I have to review material multiple times. And I think all those kind of played a factor into me being effective in medical school and succeeding in that. After graduate school, I had already completed my MCAT and my application was done. And at that time I applied, but to be honest, I didn't put in my best foot forward with that just because I was a little burnt out. And I subsequently didn't get into, I got a couple of interviews, but I didn't get into any programs that I was interested in. So at that time, I ended up actually working in the healthcare industry. and I had multiple roles. And one of the first roles I had, I was an implementation consultant for an EMR company. And that allowed me to travel and interact with different physicians in different hospital facilities. A lot of the times, my clients were either in New York or California. So I got to travel and kind of see that field. A couple of people who worked with me, some of them decided that this was the profession for them and they ended up staying in it. And others decided that they wanted to go to med school or they wanted to do other things. So I think that once again, I want to reiterate to you, there's no ideal path to getting where you need to go. There's multiple ways to get where you want to go. And actually through my working situation is kind of how I fell into the field of podiatry. I was working on a client site, and at that time, a lot of the companies were going from, or hospitals were going from paper workflows to computer-based. And I met one of the physicians in a New York hospital, and I had no idea what her specialty was, except that she worked on an orthopedic floor. She pulled me aside one day and asked me my interest in medicine, if I would be interested in surgery. And lo and behold, she was actually the head of the department, and she was a foot and ankle surgical specialty, and she went to podiatry school. So she just saw something in me that I guess like I displayed to her, that she was very interested in helping me succeed, and ended up connecting me with a colleague. At that time, I was living in Atlanta, Georgia, so she ended up connecting me with someone there, one of her classmates, and I ended up shadowing that podiatrist. And I realized the field of podiatry has so much to offer that I wasn't aware of prior to even shadowing. So I'll talk more about that so you guys get an understanding of what podiatry field has to offer and what podiatrists do. I ended up, after getting accepted, to choose to go to podiatry school in Miami, Florida. I graduated this past May with a doctorate in podiatric medicine, and I'm currently in my first year surgical residency in Pennsylvania. All podiatric programs, or foot and ankle surgical residency programs, are a 3-year program, and they are automatically a surgical residency. So I'll also touch on that and the differences. So what is podiatry and what do podiatrists do? So podiatry, I always think it's funny when patients or even people kind of like discuss with you, do you have a foot fetish? And I always think it's funny because I never go to an orthopedic hand specialist and ask them, do they have a hand fetish? And I think a lot of that has to do with the fact that people don't know what podiatry is or what podiatrists do. So we are a healthcare specialist, and we diagnose, treat medical conditions and injuries involving the lower extremity, ankle, and feet. And the conditions we kind of treat include anywhere from injuries to the lower extremity, including trauma. This could be secondary to like a motor vehicle accident. We see ankle fractures, we see metatarsal fractures, we see pilon fractures. We also treat multitude of dermatological conditions, including cellulitis for anyone who has postoperative infections. We treat things like athlete's foot in the clinic. We treat like pyoderma gangrenosum. And each of those kind of require tailored treatment. And these are something you get trained in as a podiatrist to do. We also treat wounds, and we are wound experts, and wounds can actually be caused due to multitude of things. It can be caused by secondary to arterial diseases. It could be because if a patient can have a venous stasis disease. They could be caused by pressure. If a person is not ambulating, how they rest could cause them conditions that cause wounds to develop. Biomechanical function. Sometimes people walk differently, that can cause pressures that can start as calluses and eventually lead into something more serious. And you might see a lot of people talk about how dancers have flat feet and things like that. So it's always important to consider. And then neuropathy. A huge patient population of ours are diabetic, and we take care of diabetics on a regular basis, have it be routine care, as well as like even like surgeries or infections that diabetics have because they don't have sensation on the bottom of their feet. We are their point of contact in regards to that. So kind of seeing that we do things from trauma surgery to clinic-based to kind of like plastic surgery with like wounds and following up with that. So there is a lot of different avenues you can go into for being a podiatrist. Now you might wonder, like, how do you subspecialize in podiatry? Because I mentioned how sports medicine kind of got me into this. After residency, like I mentioned, all podiatrists become foot and ankle surgical residents. So we are trained in surgery, but we can subspecialize with fellowship after residency in different options like trauma, reconstructive surgery, sports medicine, or routine care. If many of you watch football, you'll notice in the last couple of weeks, there's a lot of lower extremity injuries, even Achilles tendon injuries. We as podiatrists are able to treat that, and we are prepared to treat that. So it's a great opportunity in a field that many people do not know exists. And as you can see, we are trained to do a lot of things that orthopedic foot and ankle specialists do as well. So if you are a pre-med student and this is one of your first time kind of being exposed to the field of podiatric medicine, you might be like, what's the difference between an MD-DO and a DPM? A DPM is Doctor of Podiatric Medicine. And what essentially do you need to get there? So kind of taking it step by step, I did a visual graph or like a table to kind of see where you lie in it. So I'll go through each section and talk about that. For MD and DO, as well as a DPM, you need to complete 4 years of your undergraduate degree. I previously mentioned that I went into a biological science major, but you could be in communication, you can be in business. As long as you complete 4 years of undergrad with the pre-med requisites, including chemistry, biology, that's all that matters. The second thing, MCAT. Doctors of podiatric medicine or medical schools require you to complete an MCAT. Typically, most undergraduates who apply for podiatric school take the MCAT around the same time a DPM and DO applicants do. They typically take it either their junior or senior year, and if you're non-traditional, at some time before the application cycle opens. Once you're into medical school, how do we differ? So regardless of if you do MD-DO versus a DPM, you do 2 years of basic science, medical science curriculum. Now, you might know that DOs are osteopathic physicians, so some of their courses might include osteopathic medicine focused classes or manipulation. DPM, the same thing kind of differs. Like, we tend to have additional courses that focus specifically on lower extremity anatomy. Like I mentioned, when we start residency, we are a surgical resident. So that means from day one, we do surgery on our patients, or we are trained to do surgery. So having that extra 2 years of lower extremity anatomy is crucial for us when we go into practicing or getting into residency. We are also required to take board exams. So many pre-meds or even medical students who you might hear them talking about step one. So step one is essentially USMLE. It's a national board exam that MD applicants and DO applicants who want to take it are eligible to take. We have a similar thing, and it's hosted by a different organization. It's the National Board of Podiatric Medical Education, and we also have board exams. Like USMLE, who have step 1, step 2, step 3, we also have NBPME part 1, part 2, and part 3. So when do you take your part 1? We take our part 1 after we complete our 2 years of basic medical science curriculum, essentially the same time that an MD or DO candidate studies for step 1. That's essentially the same time we study for our part 1. The only difference is our NBPME part 1 includes that additional emphasis on lower extremity anatomy. Another difference or like similarity is a lot of times we don't have a specific book just for our boards. So many candidates actually use the USMLE step 1 book to study. So As you can see, there's actually a lot of similarities between MD, DO, DPM in regards to our educational basis so far. There's just like little nuances on what the actual test might focus on. After we finish our part 1 examination, we actually end up doing 2 years of clinical rotations as well as addition months. Now, MDs, DOs do the same. So what is a clinical rotation versus an addition month? A clinical rotation is something that all third-year medical students do. That is when students are exposed to clinical experience, including different fields such as anesthesia, general surgery, urology, vascular surgery. The interesting thing is, as a podiatric medical student, you are still required to complete certain rotations. So my third year, I actually did a ED rotation, I did a vascular surgery rotation, I did a general surgery rotation. And when you're on these rotations, oftentimes you are actually with MD and DO students. You are treated the same, you're required to do the same, your expectations are the same. So my first rotation as a third year was actually a general surgery rotation, and I was with 2 University of Miami third-year medical students, and I was also with 3 DO osteopathic students from Nova University in Florida. So at one time, you could be with multiple medical students, and you are all expected to learn and do the same things. Addition months are a little different. In MDDO, the trend is people choose to do addition months based on the specialty they're interested in. So a lot of students might decide, hey, ED is the choice for me, so I will do an addition month at this hospital on ED because I want to get exposed to it and I want to make that program know I'm interested in their program. Whereas for us as a DPM, when you do addition months, it is actually a requirement for graduations that students actually do an addition month. That means like our fourth year, we apply for what we call an addition month, an externship or clerkship, where we kind of go around, we pick programs, they offer us a position and we accept it, and we go there and we spend a month and we get hands-on clinical experience and exposure to that program. And essentially that whole month, you're getting exposed to the program, but the program is also getting to see you as a student. So you get exposed to surgery, you get exposed to clinics, you get exposed to multiple things, and you kind of gauge if that's something interests you or that program specifically interests you. And the biggest difference is residency. When I say undetermined for MD and DO, a lot of people might apply for internal medicine, but they might get family medicine, or they might be interested in orthopedics, but if their scores aren't where they need to be, they might end up in pediatrics. There's a lot of like unknown factors in regards to that, but at the same time, you also get a lot of opportunities. So it works out for a lot of people, but that's something to consider as opposed to DPM. Like for me, I knew that my interest was in sports medicine. My interest was in surgery and getting exposed to that. And I think that one definite guarantee for us is when we get into residency, we are a surgical resident. And I keep re-emphasizing that because we don't spend time where we have to declare where we go into. From day one, we are specializing in surgery. So that's a unique opportunity because the 3 years that we spend, we are doing surgery and we're getting trained in that. And that kind of sets you up for success moving forward. So now I'm kind of going a little back to talk about the requirements of podiatric medical school. So what typically do you need to do to get into podiatric medical school? I mentioned the 4 years of undergrad and I talked about requirements. Most generally, the requirements to get into podiatric medical school is the same as MD or DO, medical schools or osteopathic schools. You typically need general chemistry with lab 1 and 2, general biology with lab 1 and 2, organic chemistry with lab 1 and 2, math, it could be either stats or calculus, or physics lab 1 or 2. And when you do the 4 years of undergrad, some programs might require you to have additional classes like biochemistry and things like that. And for that, I always say, like, there's specific schools which I'll go into, and you might, if you're interested in a school or a region, look it up on their website what their requirements are. It might be just beyond this, but this is a good baseline to kind of follow. So specifically, like I mentioned, if you're a business major and you're deciding, hey, you know what, I think like I'm really interested in podiatric medical school, make sure you kind of sit with your counselor or advisor to kind of make sure you're able to take these classes prior to entering, because it is a requirement. As far as the MCAT is a requirement. The average score for the 2020 class that just started was around 494.6. Unfortunately, like when I took it, the scoring system was a little different. So I didn't get a chance to look up the average for like MD-DO versus podiatry, but I just at least wanted to put it on there for those interested so they can kind of gauge if they're doing practice exams to see where they're at in requiring their acceptance. You do need a personal statement. And I always say when you write your personal statement, make it unique and make it to you, meaning just tell your life story. Talk about what got you interested in podiatry or what led you to here, especially if you're a non-traditional. There's multiple circumstances that brought you to where you are. For me, I had a medical condition that kind of, I got diagnosed with it later on in life, and I actually got surgery for it my first year of medical school. So although it should have hindered me, it strengthened me. So that was my whole personal statement. So make it unique to whatever you feel passionate about. Letters of recommendations. Typically, you always need letters of recommendation from science professors and things like that. Podiatry school, when I applied, we needed a letter from a DPM from shadowing. So I want to say that opportunities like this, although because of the circumstances, virtual shadowing is a fantastic opportunity for you to mention in your curriculum or in your CV, your resume. And I would even reach out to some of the schools and be like, hey, because of the circumstances in the current climate, I haven't been able to shadow a podiatrist, but I actually did a virtual shadowing, or I got exposed to this profession. So it's a great way, and you have a certificate for this that you get. So it's another thing to kind of add to your resume as well and strengthen your curriculum or your CV. Another thing I recommend, if you don't know how to find a podiatrist to shadow, there is a website called stepintopod.com, or even Google podiatrist near me. You can find a mentor on that website, and you can also find like podiatrists near you. Just email them, be like, hey, I'm really interested in this profession. This is my first time being exposed to it. Can I come shadow? I mean, with the current circumstances, I know a lot of people don't have in-person shadowing, but I am actually a liaison for my residency program between me and the students, and I set up opportunities for virtual shadowing. So if this is something you're interested in, reach out. And if I'm just saying, like, as a residency program, if I'm doing it, I'm sure like there are other podiatrists or podiatry people willing to even let you FaceTime them and get you exposed to the field, even if they can't give you hands-on experience. Experience is experience. So try to reach out and be proactive about that. There are multiple ways to get exposed to the profession if you just knew where you were looking, and don't be afraid to reach out. Extracurricular activities. I always get asked this, how do I just volunteer with this? How do I do this? Do I need to just do science-based or hospital-based? I want to emphasize to you that extracurriculars should be things you're passionate about. When I applied and when I was in college, I had extracurricular activities, including like working in a bio lab where I actually got paid to set up like the introductory labs, to things like orientation leader. So it varied, and those were things that kind of interested me and piqued my like focus and things like that. So if you're in a sorority or if you're part of other organizations, talk about that. It's okay to be involved in things other than just science or health related things. Research. This is also something I get asked all the time. How do I get involved in research? I'll tell you, when I did research in undergrad, our University of Pittsburgh has a very well-known medical school, and they focus a lot on research. So I just reached out to multiple different like physicians or projects that I saw, and I reached out to people, just emailed them, be like, hey, this is who I am, I'm interested, would it be okay if I come work with you, or would it be okay? And it was a lot of time, I did not get paid, and it was something I was just passionate about and I got involved in. So if you are in a university with associated medical school, reach out to people, tell them this is what I'm interested in. Sometimes you won't ever get a response, but other times you might get a response. So just be proactive about that. And if you don't have research, that's okay too. It's not going to hinder your application, but it's always great because even as a resident, we are required to do research. So it just kind of helps benefit you if you kind of get exposed to it early on. Now, you've gotten this far and you're like, where do I apply to podiatric medical school? They have a separate application website. It's the AACP-MAS. It's different than the MD and DO, and you can choose to apply to as many of the schools as you want through that and the standardized application. One thing I recommend is if you are interested in a particular school, I would go to that school's website. For instance, I went to Barry University. I would Google Barry University School of Podiatric Medicine requirements for admission, or they have a little tab. Go through that, see what their requirements are. Are there additional prompts you got to answer? Do they need additional letters, or do they have specifics on that? Kind of do your research prior to applying. And also, each of the schools has great coordinators for admissions. If you're unsure of if your class meets a requirement, or if you're a good candidate for it and things like that, I would even reach out to those and set up a tour or message them and be like, hey, is it possible we can kind of review my application? Or is it possible you can tell me what type of applicant you're looking for? And 9 times out of 10, those advisors there at the school or admission coordinators would be more than happy to kind of do that. And I can speak for my school at Barry. They had students who are like year 1, year 2, year 3, year 4, who essentially acted as like mentors or tour guides or a point of contact between the applicant and the school. And so if you had any questions, it actually got tunneled to a student, so you can kind of be candid about their experience, what they thought, where they were going. And when I was actually picking what school to go to, and I had 3 acceptances at that time, I asked the advisor or like the admission coordinator if they can keep me in touch with someone so I can kind of talk to them about certain things. And they put me in touch with the president of the class above me, and he's a great friend and colleague now that I've gotten to know him several years. So he actually was very candid when he responded to me via email. So my point is, if you are unsure, always reach out. Someone is willing to help you and guide you in the right direction. And even for me, if I don't know the answer, I'm sure I know someone else who can help you answer what you're looking for, especially in regards to application and things like that. So how many schools are there? There are currently 9 schools around the country, and these are separated based on region. So there's 2 in California. One is near like San Francisco, Oakland, and the other one's a little outside of LA. There is New York, Pennsylvania, Florida, and there's a new one expected to be opening in Texas. The first class is to begin in fall of 2022. So something you can look forward to if you're maybe a freshman or sophomore in college looking in this profession or thinking about applying and you're from the Texas region, something to consider. This is supposedly opening in fall of 2022. So when I applied, I always get asked, did I apply to all 9? I actually applied to 6 out of the 9 just based on geographic location, but I got interview offers from all of them. And at that time, I decided I was only going to do 4 interviews because I had a full-time job. And just the logistics of flying and taking off were a little too much for me because I had a pretty involved role at work. And after my 3 interviews, I decided not to go to my fourth because I kind of knew I had a short time frame to decide where I want to go. And I also decided that, you know what, certain things were important to me. Geographic location, having my car to get to and from places, scholarship. So I would always say apply to all of them, but if you are not sure, do more research. Look on their websites to see what they're looking for. And there's always social media actually plays to your advantage because many of the schools have student run Instagram accounts that kind of give you a day-to-day on the program. So reach out to them if you're interested in another way for you to connect with them. And I know in the role of social media, everyone kind of can connect you with someone. So I think it's a great way to kind of see, is the school right for me? Oh, where are the alumni now? Or what are these residents doing? So I think it's a great thing to consider when you're applying to a program as well. So what does a typical medical school curriculum consist of for a podiatric medical student? So I kind of broke it down between year 1 and year 2, and it very much differs based on school to school. Some of the schools like Western are associated with a DO school, so their curriculum is a little different compared to ours. So this is strictly based on when I was in school. This was kind of the year-to-year breakdown. So year 1, you kind of have an introduction, and when you're looking at it, you might seem a little overwhelmed at all the classes you're going to take and where you're going to go. One of the reasons I really emphasize being a non-traditional is physiology, biochemistry, histology were all classes, even statistics were all classes I either saw as an undergraduate or that I saw as a grad school or grad student. So it really strengthened me in the sense that I knew how to study for these classes and I knew what was expected going into them. That kind of helped me succeed. I was a tutor for biochemistry as well as physiology. So I think it is very doable to get involved and succeed if you're a non-traditional. I know a lot of times I get asked, weren't you scared that you were out of studying for so long that you went back in after 3 years, were you able to be successful? And I think that you can be, you just have to be mentally prepared. And I think being a non-traditional for me personally helped me get in the right mindset of my expectations. And mind you, at that point, I had already known what was effective for me to study and how to do well, that oftentimes that I would give myself a set time to study. And once I completed it, I was able to hang out with my friends or explore my new city. So it is possible that when you are in medical school, you can have a life outside of it. It might not always be like that, but you can have the balance that you need. And for me, being a non-traditional really played to my advantage. But like I said, everyone's path is different. Some people who are pre-meds have a very good routine or study schedule and it works for them, and that's fantastic. Me personally, I think I grew when I was in grad school, and that's kind of strengthened me going into later on. So what is 4th year into residency like? So my 4th year is what we do, those addition interviews or clerkships. Clerkships are exposed students to all facets of podiatric medicine and surgery in the hospital, professional setting, clinical settings. And the student, essentially, this is from our national guideline, the student clerk kind of gains essential experience managing the care of patients, learning the roles and responsibilities of DPMs. So when you are doing your clerkships, like I mentioned, every school has a different requirement, how many you need to do. And my school required us to do 6. So I did 6 addition interviews. So I did 1 in California, 1 in Seattle, I did 1 in DC, I did 1 in Pittsburgh, I did 1 in Florida, and I had another 1 in Florida that I had set up. So it gave me and as well as Scranton, sorry. So I ended up having good exposure to multiple programs. When I picked my clerkships, my mentality going in is we pick our clerkships a year before. So especially when you're a 3rd year. When you're a 3rd year and you have just finished studying for boards, you kind of don't know what to expect. You don't know if you're going to love surgery, or you don't know if you're going to love the clinical setting. You don't know what essentially you're looking for. Maybe you're really into research and academia. So I tended to research and pick programs where I did 2 academic, 2 surgery heavy focus programs, and 2 clinical setting heavy programs. And going through those experiences kind of helped me define what I wanted in my head moving forward. So after we get accepted to our clerkships and we complete them, we take our part 2 boards. Our part 2 was essentially what I talk about. It's like step 2. You take it your 4th year in December prior to your interviews. We also do something called CSP. It's the clinical aspect of your boards where you fly to Philadelphia and you get standardized patient and you see the patient, you talk to them, and you're required to do a note and kind of like practice writing that, diagnosing. So DOs do it in the same facility we do it, and it's the same patients, but different like diagnosis and care. And you get 6 months to do that, essentially meaning like they have different time slots and you just pick it based on your availability. But that's also a requirement prior to graduation that you pass your clinical as well as your written part 2. Interviews are like the biggest difference for podiatric medical students going into residency. MD, DO, a lot of them, like you go to visit the program, but it's just getting to know the person. As opposed to that, for interviews, all our programs who are eligible fly to, Frisco, Texas. And when they're in Frisco, we fly to Frisco, Texas, and it's in a hotel room. There's like multiple rooms and floors, and every program has a room or multiple rooms. So sometimes you rotate through, like for the program I'm in now, they typically get 3 rooms. So the first room is your social aspect, and you do things like surgical hand ties while you're talking about you or getting to know you. They want to see you are able to multitask as a surgical resident. The second one is typically a case study. You're presented a case and you're asked to kind of walk through the case and see how you'd handle it. The last one is rapid fire, where they ask you different things like antibiotic treatment, things like that. So the biggest difference is interviews. Interviews is when most of the programs come to Frisco, Texas. You apply for them, you get granted the interview, you schedule it, and then you go to Frisco and you rotate through within a span of like a week and a half to interview at all the places you have elected. After interviews are completed, you get about a week to complete any remaining interviews. Some of the programs do not come. So for those programs, that's very far and few in between. Most of the programs do come to Frisco, but if they don't come, you do them at the place they're located, and you submit your rank list. Rank list is essentially ranking the programs where you want to match at. So for instance, I interviewed here, then I'm eligible to rank this program. I interviewed at Stanford Med, then I'm eligible to rank Stanford Med. Then comes your match day. Match day is standardized for MDs, DOs, and DPMs. We all get it the same week, and it's typically like the second week of March. On that Monday, you get a notification letting you know that you have matched into a program. It doesn't tell you where. And if you haven't matched that day, you get the opportunity to what's called scramble or look at available programs that you can kind of reach out to. And then Friday is when you find out where you're going. And for those who didn't match, get the opportunity to visit or interview at all those programs starting at that. For my instance, I did match on Monday, and on Friday, I found out I matched in Pennsylvania. And residency. We do a 3-year surgical residency program. We start the same day as all interns in July, and we finish after 3 years of completing our surgical residency. So what's a day-to-day life for me as a resident? So first year is considered an intern year. Now, mind you that it kind of varies from program to program what a typical day-to-day is. This is something you get exposed to when you go into visiting programs, when you do your audition months. You kind of see what the expectations are for different programs. Different programs might not have first year rotations. They might vary their rotations to second year or third year. So it kind of really depends on the program you're at and what you want out of it. I really liked have my program focused our first year to be an intern year, and I'll kind of talk about why in a minute. So as a first year, these are the rotations you get to do. You do a month of a month of anesthesia, a month of orthopedics, emergency medicine, internal medicine, research, radiology, infectious disease. And we do essentially 5 blocks of podiatry. That includes anything from surgery, managing your inpatients, to being in clinic. So I just finished my block of podiatry today. So for instance, yesterday my day was more like I started in clinic, I had surgery in the afternoon, and then that was it. Today I was in clinics all day, and then in next week I go back to podiatry. I start my next block, and I will be on podiatry for another 4 weeks. And my first 2 weeks I'm on inpatient floors, so I manage all our inpatients. So as a first year, you get exposed to a multiple things. And I think it's very important to kind of get exposed to that, because if you realize that a lot of our population might be diabetic, but at the same time, managing their medications, if they're inpatient, you rely heavily on your internal medicine team or counterpart. Or say a patient has a motor vehicle accident and they come into the ED or the trauma bay, you get paged because it's an ankle fracture. You have to know how to manage that patient, and you have to know the protocol. Or for instance, if a patient comes in post-operative and they have cellulitis, you need to know like what antibiotics would I give them. So kind of knowing all the multiple different rotations your first year makes you part of an interdisciplinary team. And I think that's very important to know, that podiatry is an interdisciplinary profession. We do not just treat one thing, we look at a patient like a whole. So a lot of people have this idea that we just deal with the foot and ankle and we don't understand what's going on outside of that. And that's not necessarily true. Like even if you're in clinic, a patient might be seeing a rheumatologist for something else, and before you give them a medication, you might need to work with the rheumatologist. For example, I have a patient with pyoderma gangrenosum. I have to work with their rheumatologist while even when they're in-house, kind of coordinating their care based on their steroid medication and things like that. So it's very important to know that podiatry is a profession that is interdisciplinary, meaning that we do not just treat the foot and ankle, but we have to know all aspects of medicine. So what do I expect on a day-to-day as a foot and ankle surgical resident? So I'm going to start at the left and go to the right. These were all things I got exposed to when I was a 4th-year medical student. The patient information has been removed, and they have been they were consented prior to me using this. So just wanted to throw that out there. So on the left, you see a wound on the anterior leg. The patient came in, he says he's had this wound for about a month. He hit it on something, he doesn't remember, his pulses are not palpable. When you Doppler him, they're weakly monophasic. So looking at that, and you're doing like serial debridements and trying to treat it, but it's not closing up, it's healing or not healing, you listen to the pulses and you're like, okay, it hasn't been healing because they don't have good pulses. You immediately kind of consult your vascular counterpart. So once again, I want to emphasize that you work in an interdisciplinary team. So typically a lot of our patients go for bypass surgeries, and we do staged procedures because we work as a team to treat the patient. So something important to consider. The middle picture shows you a fibular fracture. This kind of highlights to you that when this patient was playing volleyball after many years, he fell down and he felt like he hurt his leg. He couldn't bear weight on it. He came into the ED. We got consulted for it. We as podiatrists also learn how to read radiographs from day one. It's part of your medical school curriculum. You're like 3rd year, typically 2nd and 3rd year. excuse me, but you also need to know, oftentimes when you get imaging back, you don't have a radiologist read it. If it's at 3 a.m., you need to be able to identify, hey, this is a fracture, or hey, this is a gas gangrene, which is a surgical emergency. So another great thing about this profession is that I feel confident enough to read a radiograph, and I'm still learning, but I'm learning, I know enough to identify when I have a patient who has an infection or a fracture. And the last one on the right is a patient who came in with an open fracture secondary to a motor vehicle accident. An open fracture is a surgical emergency, and we have to take the patient out. So things you want to consider for this patient, you always have to ask them their tetanus status, or you have to ask them when's the last time they ate. Since this is a surgical emergency, you're going to have to take them to the OR. So for anesthesia purposes, you need to know when's the last time they ate. So things like that you kind of get familiar with. And I want to emphasize knowing all three. We have to know how to read x-rays. We work on interdisciplinary teams. We also work in the ED. So podiatry is not just clinic, looking at feet, cutting toenails. There's a vast variety of different options, and you're trained from day one how to kind of treat all of these. So at this time, I'll leave room for any questions. I do have an Instagram that I kind of just focus on medicine, podiatric medicine, kind of help pre-meds with. I also post opportunities where I have research that if I'm working on and I can make it available to medical students or pre-meds, I try to do that. I edit a lot of personal statements for medical students and things like that. So if you have any question regarding podiatric medicine or concerns about that, or like thinking about applying, or you want to know how to shadow, you can message me on there. And I also have an email where I go through and kind of check on a regular basis to kind of connect with people. So I want to thank you guys for your time, and I'll leave room for any questions that if you guys want answered.
Thank you so much for this very informative session. There's tons of people in the chat literally saying that they are so excited. They kind of want to be a DPM now, and they also thanked you for going through and kind of explaining the difference between the MD-DO route and DPM route. So thank you for that. It was very thorough.
No problem.
There were a ton of questions. I saw a lot of people asking if you could just expand more on how clerkship works. Like, is that something that, you kind of get matched into? Is it something you have to seek out yourself? Is it more like an internship? If you just kind of expand on that.
Yep. So for all podiatric programs, your third year, if you pass boards or everything, you apply through what's called a Casper CLIP. It's the national organization. You apply for clerkship. So you might be like, I want to do a clerkship at MedStar, or I want to do a clerkship at Stanford. So you technically get, depending on the school and your availability. So for us, it was typically May to December was your available months, and you had to give 1 month back to clinic, which you were already pre-assigned. So for my instance, I was already told that June I would be back in Florida working in our student-run clinic. So between May, July, August, September, October, December, I had to fill with months of clerkship. So I applied to all these programs, and I would pick the available months that I wanted to go there. So that program, you go through rounds. So round one, you submit your application. It's the same thing. You do your CV, you do your personal statement. They kind of look at it, and then they're like, okay, we want to give this candidate a month-long audition interview, say in May. So I would get the response back. Everyone gets it back the same time, and you have 24 hours to either accept it or decline it. So say that you already filled your month of May for Stanford Med, and MedStar also offered you May. You can go back into round two and ask MedStar, hey, can you give me October? So it's kind of like a lottery system of where you want to go. So it's very important that you kind of like sit down and formulate a plan and have options and backup options, because a program could say no to you. For example, that I applied to a program in San Diego, and they never actually offered me a clerkship month. So I had to find an alternative to fill that month since I didn't get a response back from them. So it's run through a portal that's run by the national organization, and your school kind of walks you through it when you have to apply. So it's an addition interview that's month long, but all fourth year students kind of do it whenever they apply.
Great, thank you so much for clarifying that. There were some questions about, so you put up like a, what you would see in your first year residency, and someone wanted to know if there's any of those that you haven't gotten to yet, that you're really excited for, or which one has been like the most exciting for you?
I loved my ED rotation. I loved that my attending in the ED, they would ask me a lot of questions, but I just love that it made me feel so prepared, and he let me reduce a hip. He's let me reduce like a shoulder. So things that like if someone needed my help, I feel qualified to do. And also you see a lot of things like people with kidney stones and things like that. So I learned how to read like a CT or MRI really well, not just for like the foot lower extremity, but also overall body. And then things like I needed a plan for a lot of them. Like, so I felt like that was my favorite rotation thus far, just because how much hands-on experience I got. I still have quite a few away like rotations to complete. My next away one is orthopedics, which will be in January. And typically for orthopedics, in our program, orthopedics and podiatry is the same interdisciplinary team, except orthopedics do a lot of like hand surgery, hip surgery, things like that. And we get to scrub in on those, and we kind of log those as first assist as a resident. So that's the only difference.
Great, thank you. You also are so good. You already asked another or answered another question that someone had about the difference between orthopedics and DPM. So perfect. A lot of people, you mentioned like moving a lot. A lot of people are just wondering if you enjoy that, like moving around, going away, or do you wish you had just stayed in one place?
I think that for me at that time, I wanted to get the best training possible. And not that I'm saying that where my school was located or the programs in Florida wasn't the best training. I just wanted to find the best well-rounded training for me. So, and like I said, I wanted exposure to programs in different regions because different regions run things differently. There's different scopes of practice in different areas. And there are different types, styles of programs, academic, clinical, surgical. So although they're all surgery based, some programs don't let first years typically do surgery till the second half of first year. And for me, I felt that from day one, I wanted to be knowing how to do surgery or being trained to hold the knife, suture, and things like that. So that's kind of what determined where I personally wanted to go and how I did my rank list, because to me, I get 3 years to be trained to be a surgeon, and I wanted to get the most hands-on experience, because it's one thing to think about it and it's another to do it. And although it may look simple, there's a lot of things that go into it and technique and things like that. So for me, that was like a huge determinant. And as far as moving, I think you're so busy with work, you don't really notice, but it just requires a lot of planning ahead of time and managing your finances and things like that. So that's something I really sat down and discussed with my parents and my siblings as well, just to see how I could afford it. And it's a lot of planning, but if you're organized and you can be effective in that, you will be successful.
Great, thank you so much for answering that. There's a ton of people that really just wanted to know about when you're applying to podiatry school, is there a GPA requirement that's similar if you were going on the MD or DO route? Is that something that like is as much of a pressure? If you can expand on that a little bit.
So like previous years, I would say no. Like back like 8 or 9 years ago, it was like kind of like a known factor said that podiatry school requires a lower GPA. In recent years, looking at the trends, it's the same thing as like they look at the average applicant, and the average applicants had similar MCAT and GPA or science GPA going in. And although it seems like a lot of pressure, I highly emphasize that if this is a profession you're really interested in and you're halfway through college and you don't meet the requirement, reach out, shadow multiple people, kind of build your resume in a different route, or even do a post-bac or a master's program. I think for a podiatry standpoint, I think that as me, even like when students reach out to me, I want to see their interest in the program or interest in the profession. And I think consistency is key. So I would say it kind of varies person by person. So if you feel like you're not meeting it at a certain end, I would just reach out to a particular school that you might be interested in and kind of have the admission coordinator go coordinate with you to see where you can improve on.
Great. Thank you so much. Yeah, so there was this one question that a lot of people were wondering about is if you can get an MD or DO and still be involved in podiatry.
I think that like I mentioned, we work in multidisciplinary teams. So we work with MD and DO counterparts on a daily. Like at my hospital, I was on an internal medicine rotation and I am a podiatric surgical resident, but there was a resident from family medicine, there was a resident from psych. So you can work with them, but technically the path, not really. Like either you go to MD school completed and then you go to DPM, or you do DPM and then you can do an MD. There's no like merging or anything like that. So if that was the question, then there's no current like path that merges it as far as I know.
Yeah, great. I think that answered the question. I think that's the majority of the questions, unless there's any more that anyone wants to ask. But yeah, I think that's it. I guess the one last thing we'll ask you is, as you know, we are pre-med students or pre-A or post-bac masters, you know, all different kinds, kind of finishing up this, hopefully, pandemic. What is, you know, a last piece of advice you could give us?
I think that it actually plays to a lot of your advantage because like we as like even residency programs, we couldn't have a lot of students come visit us because of the pandemic and just being cautious and mindful of that. So applying next cycle after a pandemic, I think a lot of programs would be willing to understand that. So it, like I mentioned early on, like doing shadowing sessions like this or being involved or reaching out to podiatrists in this format or even any medical professional, I think we all are willing to help out. And I think there's different ways you can meet the requirements in that regards of shadowing and things like that. So I think it plays to your benefit. So if it's something you're interested in, I would say continue pursuing the virtual shadowing and things like that.
Thank you. Also love that plug, so keep coming back for next semester. But yeah, thank you so much for being here and giving us such an informative session. There's tons of people that were just, you know, praising you, thanking you, and also you definitely gave them a lot to think about. There was a comment earlier that was like just saying that they thought they knew what they wanted to do, but now you've kind of like skewed them and changed their mind a little bit. So now they're like so stressed again, trying to figure out what they want to do. So.
Well, I hope I didn't stress anyone too much, but like I said, if you're really interested in the field, I definitely would be more than happy to talk to you because I never was exposed to it till later on in my career. So I understand. So if you need to reach out to me, I'd be more than willing to discuss anything regarding podiatry.
Yeah, absolutely. Well, thank you so much. We appreciate it. And yeah, well, I'll be in contact with you. I have an idea for you. But other than that, thank you for being here and giving us your time.